If you're getting close to retirement, there's one big expense that sneaks up on almost everyone, and that's healthcare. Even with Medicare, you could spend hundreds of thousands of dollars over the course of your retirement. But here's the thing, you don't have to sacrifice great care to keep your healthcare costs low. Today, I'll show you how to manage those healthcare costs in retirement so that those surprising bills don't sneak up on you and don't ruin your overall retirement experience. Hi, I'm Dre Griggs, founder of Obsidian Wisdom. I help people 5 to 10 years for retirement put a plan in place that gives them more wisdom and less worry. Let's be honest, most people underestimate healthcare costs in retirement. The thought is, when I'm 65, I'll get Medicare and I'll be covered, rainbows and skittles. But the reality is, our healthcare costs actually tend to be around $200,000 to $400,000 over the life of our retirement, depending on the different needs that we have, on the times we go to the doctor, everything from our co-pays, our overall deductibles. We're talking about Medicare Part B. Medicare Part D also has that. Whether we have Medicare Advantage, which has your vision and your dental, or if you have a Medigap program, and then those will cover a lot of those other expenses, but they do have monthly premiums tied to them too. So you haven't even mentioned long-term care. When we start listing all these healthcare expenses, even if we have the most minimum of minimum, we're still should be expecting to pay relatively a decent amount of money every single month for the life of our retirement. So when you start taking a step back and you look at these overall expenses, you can see why the thought that, well, when I'm 65, I have Medicare and I'll be fine is probably a little bit too simplistic of a view. In fact, when you look at the numbers, you can see that Medicare Part B has a monthly premium of $185 in 2025. You can see that you have to make less than or equal to $106,000 as an individual, or you just double that, $212,000 as a couple. They have a 2-year look back window. So what they'll do is they'll take a look at your income over the last 2 years, and that's how they decide what bracket that you should be in. So you can also see that if you make over $106,000, but less than $133,000 as an individual, that they would add $74 per month every single month for the rest of your retirement life. And that is called your IRMAA, your income-related monthly adjustment amount. And that number changes depending on how much income you have. Now you can see if your income average over those last 2 years was greater than $500,000, if they could add up to $443.90 on top of your overall monthly amount, and that would give you $628.90 as your monthly premium. And so you can see why Medicare Part B is something that we are going to pay. And that is something that we do need to be thinking about when we're looking at our premiums. Now, for your Medicare Part D, the amount that you'll pay each month depends on the type of plan and the carrier that you choose. But you also will see that Medicare has an IRMAA attached to that as well. And you can see that if you make $106,000 or less, or $212,000 as a couple, there will be no income-related monthly adjustment amount. Nothing will be added on to your monthly premium. You can see that as you make more, that the amount that you have to pay, in addition to the monthly premium that you have set with the plan that you choose, it does increase. And all we're saying is that these costs are going to be something that you pay the rest of your retirement life. Now, we'll go into some strategies to manage that cost without sacrificing the care, but it is something that we do need to be thinking about, that it's not I get to 65, I have Medicare, and now everything's affordable and low cost. There are premiums that I'm going to be paying for the rest of my retirement life. It's probably also worth mentioning that if you enroll in Medicare late, as in you don't do it in that 7-month window where you have 3 months before 65, the month that you turn 65, and 3 months after 65, that there is a penalty, a lifetime penalty associated with your monthly premiums, a Medicare Part B and Medicare Part D. So you can see that Medicare Part B has you pay an extra 10% for each year that you could have signed up for Part B, but you didn't. And so on the Medicare site, they actually give you an example. They say if you waited 2 full years, that's 24 months to sign up for Part B, that you would have that 10% penalty for each year. And so with the Medicare Part B monthly premium at $185 in 2025, that you would expect to pay 10% each year, 2 years, that's 20%. And 20% of $185 is $37. So you would pay $222 every single month for the rest of your retirement life. If you look at Medicare Part D, you pay an extra 1% each month, which is really 12% per year. They give us an example here as well. So it says if you were 14 months late to sign up for Medicare Part D, that you would have that 14% late penalty because it's 1% for each month, and that the penalty amount comes to the national base beneficiary premium of $36.78 in 2025. And so in 2025, you would end up paying $36.78 times that 14%, which would be an additional $5.20. That would be your monthly penalty that you would end up paying from 2025 on. Now, you may say, well, Dre, that's not a lot. And I'm not saying it is or it isn't, but I am saying that it is something that we should be thinking about when we're making our Medicare coverage decisions. So now that you understand all the moving pieces and what the overall problem that we tend to find with rising healthcare costs, let's talk about what is causing those issues. So in addition to the premiums in your prescription drug costs and IRMAA driving up your monthly expenses or just your overall healthcare expenses in retirement, you also have the fact that long-term care is something that is not covered by Medicare. And when we talk about long-term care, the numbers show that on average it's going to be 3 years for us in retirement, that people 65 and older, 7 out of 10 people will have at least one long-term care episode. And over the life of our retirement, it will be 3 years. And that's the average. It's not to say that it's 3 years in a row, but what we're saying is it might be 6 months here, it might be 3 months there. Then over the life of your retirement, it ends up being 3 years on average. And that when you look at the cost of either having home health aid, so that's when the nurse comes to your house, however many days a week that you have them show up, or whether you go to assisted living facility where they're probably going to help you part-time, is not something that is like full round-the-clock care, but then you also have what would be considered maybe like a nursing home, and that the idea of a nursing home would be full around-the-clock care. When you start looking at long-term care, whether I'm having full-blown coverage, a little bit of help, or you come to my house once a week, that it can vary on the cost. But on average, the cost tends to be somewhere around $50,000 to $60,000 per year. And so then that sets you up with basically having to decide, how am I going to cover my long-term care expenses? Because you could have the Medicare covered where we said, hey, that's about $200,000 to $400,000 a year. Or you would then say, well, all right, well, that's covered, but I have another $200,000 for long-term care that may or may not happen. But it is something that we do, as we mentioned, need to be thinking about because it could blow a hole in our retirement. Imagine having to spend an extra $200,000 that maybe wasn't a part of the calculation of your overall spending in retirement. That could be something that could significantly decrease the chance of you making it to the end of your retirement without running out of money. We also want to think about it from a timing perspective, and we'll talk a little bit in the solutions in part 3. But when we're talking about the timing, what we're basically saying is a couple things. One is it depends where we take our income from. That when you're looking at Medicare and the fact they have the 2-year look back, they don't count all of our income streams the exact same, meaning that some of the income is not considered in the calculation of our IRMAA, where we're saying we have $106,000 a year or $212,000 a year for a couple. Well, if we're taking the income from certain accounts, it's not counted on that total. But if you take it from other accounts, it is counted from that total. And so a couple things can happen. One is that can push up our overall monthly premiums for Medicare. We already looked at that. We're talking about lifetime premium increases. And two, we could be accidentally moving ourselves into a higher tax bracket to cover some of these healthcare expenses. That if I have to spend the money, depending on where that money is coming from, maybe it's not even a consideration for my IRMAA. I'm just worried about my overall taxes, just the amount of income I have to take out each year to cover some of these overall expenses. Now, the good news is we don't need to have the tail wag the dog, which means we don't have to be focused on lowering our healthcare costs by just lowering the quality of our care, that we don't go see our doctor, or we get the cheapest Medigap plan, that there are ways to lower my healthcare expenses in retirement without me necessarily having to sacrifice the quality of the care that I want in retirement. And so first and foremost, you would consider taking money out of like a Roth account or a health savings account, or HSA. Those are two accounts that are just not considered from a tax bracket perspective, and they're also not considered from a IRMAA bracket perspective. And so what we're saying is you can have the money that is taken out in those 2-year lookbacks, that you focus on taking money out of your Roth account. And then when you take the money out of your Roth account, that doesn't count in deciding your Medicare brackets. And so when you look at your health savings account, that's the one that we talk about as the triple tax benefit. That's the one that we love a lot. And it's because the money goes in tax deductible. It's not counted as ordinary income the day that you put the money in the account. The money grows tax deferred, which means each year that the money is growing in your health savings account, it does not count as your income. You don't have to claim it. And then the money comes out tax-free as long as you spend it on healthcare expenses, which we all agree we all will have in retirement. And so if you have the money coming out of your Roth or your health savings account, that does not count in the calculation of your taxes or your IRMAA bracket. The second thing I would do is make sure that I'm picking the right Medigap plan. If I decide that I want to have a Medicare supplemental plan, which is a very fancy way of saying that Medicare is offered by the government and Medigap is offered by private insurance companies, but they work together. You can see that the majority of people found that the Medigap Plan G is the most beneficial plan for them. You can see that the second most often used plan is the Plan F, but the thing about Plan F is it's not offered anymore, so Plan G is kind of the next best option. And then Plan N is going to be the next choice that people have, but most people like Plan G. And Plan G is going to have a little bit more of an upfront expense associated with it. But with that said, it's going to offer you the most bang for your buck if you're someone that goes to the doctor on a regular basis, because it has all the caps. And you can see when you look at the Medigap plans, now you can see that Plan F is the one that has every box checked off. So, I mean, come on, what can we say? We don't have to really think about it. And that's why everybody loved Plan F. But you can see that Plan G is the next best option. And you can see that the only thing that Plan G doesn't offer that Plan F used to offer or still offers if you were able to get plan before they got rid of it, is you can see is the Part B deductible. So that is no longer an option that is being assisted with in the Plan G. And then the next option that you see is Plan N. That's the third most common option that people are choosing. And you can see that that one doesn't do anything with the Part B deductible, and it doesn't do anything with the Part B excess charges. Now, for those that don't know, when we say excess charges, it's basically just as it sounds. There is a certain amount that these doctors that are on the Medicare plan agree to charge you for Medicare procedures. But there are some doctors that will say, I'm going to charge you in excess of Medicare. And that would mean money that you end up paying out of pocket, right? There's certain limits, there's certain amounts, and the yada yada. We won't go into all the details. But the idea is that there is an excess amount that I'm being charged over what Medicare says is the part that they'll pay. Then someone has to cover the excess. And what we're saying with Part N is that they don't give you that coverage. You don't have any help paying the Part B excess charges. Now, if you're someone that has your doctor network and you've seen all of their premiums are aligned with Medicare, you may not care about the excess coverage. That would be a reason that you would choose that one. You don't feel like there's a reason to pay that monthly premium if I know for a fact my doctor isn't going to charge me more than that. But if you're not sure, or you're worried about being out of network and traveling or these different things, whatever the concern you might be trying to avoid is, then having the Part G is why the majority of Americans do. They're not 100% sure that they'll never receive a bill more than what the Medicare coverage caps are kind of set at. And so that's just something that they don't even have to ask their doctor about. They don't have to think about it as much, right? Obviously, everything has a limit. They're not going to just cover $1 million procedures, but they are saying that we're going to help you with some of those excess caps. The third thing I would consider doing is just shopping my Medicare Part D plan every single year. So we know that Part D is the prescription drug benefits. And it's just like those old commercials that you see where everybody talks about your car insurance and they're like, well, we're going to be able to save you 20% on average, right? You've seen those car insurance commercials. And the reason that that ends up being a true statement for all of them, because I don't know if you've ever wondered, I've wondered, how is everybody saving me 20% when I switch over? And a part of it is, well, your car is worth less. So if your car is worth less and I give you the same coverage, but it's on a smaller amount, I probably could save you 20%. That's just kind of what the average change is, that your car is a depreciating value. If your car was worth $30,000 the year that you got your first insurance and is worth $20,000 a year now, even if you have the same coverage, it's a smaller monthly amount, and that's where the 20% comes from. Your prescription drug benefits, while it may not be as clear of a slam dunk, the idea is that as I get older, my prescription drugs are changing, then maybe the monthly premiums will change with a different carrier. And Medicare is aware of this, so they give you the ability to compare prescription drug benefits of Medicare Part D. And then whenever you have open enrollment, it might be the year that you want to make that change. The fourth thing we want to look at is normally planning for long-term care. We've already mentioned the numbers where 7 out of 10 people 65 and older will have at least one long-term care episode. We talked about the fact that on average it's 3 years. and that the cost on average is going to be about $60,000 a year, which means that if we want to self-fund it, that we need to have about $200,000 set aside. It means that if we were interested in having it funded by someone else, some insurance product like long-term care insurance, that we would want to be looking at that probably around our 50s. That for most people is going to be somewhere around that 45 to 55 is when we would start looking at and exploring whether long-term care insurance makes the most sense for us. And a part of it is we have to be approved for it. It's insurance. So we want to do it when we're in relatively good health. The premium that you pay each month increases as we get older because the insurance companies know the numbers just like we do. There is a bump in expenses if you ever were to try to get it over 60. So the insurance company has two choices. One is they just decline you, which is not out of the ordinary, or they'll charge you a much higher amount per month. And depending on how much they charge you, it make the most sense for you to get the coverage through the insurance company if we wait too late. That is why they're only around 45 to 55 that will at least consider the plan, whatever the plan is. But if we want to have the insurance, then that would be the time for us to start looking at applying and getting approved for that. And ideally, if we start on the earlier half of the 45, maybe we do 5 years and we make adjustments where we get our weight right and our vitals right and our health all checked off. And then we're able to now be approved for the long-term care at like 50 to 55, then we've already put the plan in place. We give ourselves 10 years to get ready. Other people will say, well, all right, Dre, well, I've already done all the stuff that would get me approved, but now I feel great. I think I'm going to focus on preventative care. I'm going to go walking. I'm going to meditate. I'm going to lower the stress in my environment. I'm going to eat healthy. I'm going to have more fruits and vegetables. I'm going to do all these things. So that way my body will be functioning very well. I'll be in great health. And then I'm going to decrease the chance of me being in that 7 out of 10 and increase the probability of being in the 3 out of 10 that don't have a long-term care issue. Those are all things that you would want to consider. But we do need to be taking a look at what our long-term care plan is, because it is not something covered by Medicare. And there are people who will just say, well, I'll use Medicaid. But Medicaid is not easy to get approved for. Reality is that's normally going to be a 10-year process as well. We have to start moving assets out of your name. We have to align things in different trusts. There are so many pieces that you have to put in place that, again, that's not something that you wake up at 64 or 65 and say, well, yeah, my long-term care plan is to use Medicaid. No, we need to have our long-term care plan started at like 55, or maybe we would from 45 to 55, we would be focusing on, well, I'm going to go with the long-term care insurance. But then maybe from 55 to 65, we could then shift towards, I'm going to make sure I qualify for Medicaid. I'm going to look at my assets and see where it has to be under for me to be able to qualify for that. And if you're someone that says, well, I don't want to do either of those, I'm just going to self-fund it, then while the number is $200,000 today, it's important to remember that that cost goes up with inflation. In fact, healthcare inflation is higher than normal inflation, that our healthcare expenses typically tend to go up closer to 6% every single year. And a lot of it has to do with the way that our healthcare system is designed. You go to the doctor, they charge you whatever they are going to charge you. You have no idea. You just paid whatever your co-insurance or your monthly premium is. But the reality is that is a cost that is then covered by the insurance company. And then the insurance company the next year is going to look at everything they paid out, and then they're going to increase how much our monthly premiums are. And that's why our health expenses tend to go up so much. A lot of people were just not aware of how much we're being charged, because in our mind, it doesn't matter. But I typically am on the side where everything matters. It's just how much doesn't matter. And your health expenses, how much that doctor charges your insurance company does matter. And that even if we're just paying $50 or $100 per visit, it doesn't change the fact that they're then billing a $500 to your insurance company, that then becomes your monthly premium for the next year. That you're not getting away with just the $100 doctor visit, that you are paying it in that monthly premium that you pay for your healthcare insurance. Now, I have seen what some couples have done is they looked at something called a shared coverage rider. And it sort of just doesn't sound right, it's shared coverage. And the idea is, if I look at the numbers and it says that 7 out of 10 people have at least one long-term care episode, and that the average cost over the life of our retirement of 3 years is $200,000, well, then that would be $400,000 for a couple, right, Dre? And I'll be like, yes, that would be true. And they say, well, what if my wife was the healthy one and she doesn't actually need the $200,000, but we got the insurance? What do we do with that? Is that money that we just missed out on? And so what they've done as insurance companies, and what some people have done, is as a couple, you'll get a shared coverage rider. And so the idea is if I have $200,000 for me, my spouse has $200,000 for her, and then I have the long-term care, I spend my entire $200,000 benefit, I could then use hers because she hasn't touched hers. And so we have a shared amount, so I'm able to use some of hers to cover some of mine. Because that does happen where one person ends up using it and one person doesn't. Does that mean nothing happens? Now, you do want to be mindful of that because, right, it's unlikely that we're going to pass at the same time. And that if one of us passes, that's the one that was sick, let's just assume, right, the sicker one is going to pass first. Well, that means that the healthier one doesn't have the long-term care coverage necessary when they don't have a spouse to help them. Now, maybe you have children, maybe there's things that you've put on the side, but it is something to consider that we can't assume that because we're healthy now that we're healthy forever, and that the healthier one is always going to be healthy, right? It's just something to be thinking about when you're talking about how we want to use that shared coverage plan. And the fifth and final consideration of managing our healthcare costs without sacrificing our care is our income. Whether we're talking about the monthly premiums, we're talking about withdrawals, or we're talking about taxes, all of that goes into deciding how do I make sure that I can fund my healthcare expenses, but I possibly can lower the expenses without lowering the care. That if I have the money inside of a health savings account, which just requires you to have a high deductible plan, and they can place the money inside of there, well, that is less money that I have to take out. Why is that? Because the money is tax-free for healthcare expenses, which means that if I had a $10,000 procedure, I just take out $10,000 for the procedure. But if the money is in a taxed account, well, that means that I have to take out $10,000 plus the amount to cover the taxes, because I do have to pay the taxes. So maybe I have to take out $12,000, maybe I have to take out $15,000, whatever the amount ends up being, that does add up over time. When you're talking about your withdrawal strategy, we're really talking about a timing that if the sequence of returns, the idea that the stock market is losing money, or that my real estate property is losing money, or that my business is off season and I'm losing money, and I have to take out the money during the low times, that means I'm locking in the actual losses. And if I'm locking in the losses, that's decreasing the amount of money that I have later to spend on my healthcare expenses. That the idea of me being able to have a withdrawal strategy that is future-proof in many ways, which is a very fancy way of saying that I've already taken into consideration the fact that we have a recession once every 10 years. I've taken into consideration the factors that cause the recession and the four economic climates that I talk about in other videos, and I'll put a link to one for you. We are able to say, I'm in the best position. So for me, as you know, I'm a big fan of the three bucket strategy because it gives me the time that the market needs to recover. It's never a question of will the market recover, right? It's not the idea that the market will never recover. Even from the Great Recession in the early 1920s, we know that the market will recover. It's just a question of how long does it take to recover, and the question of whether I have income streams that are not tied to whatever the asset is that is losing money currently. As long as I can wait after 9/11 a couple of years, I know the stock market will recover. That if I can wait a couple of years after the Great Recession, I know that the stock market has recovered. That I could wait a couple years after COVID, I know the stock market has recovered. So that just means I have to have a strategy that allows my money to recover while I'm able to live off of an annuity or pension or CDs or money market account or some bonds, while allowing my aggressive assets that are outpacing inflation to recover. Right? That's what we're talking about with your withdrawal strategy. And then from a tax perspective, I equally feel tax diversification is very important. Whether it is me having money that I spend out of the Roth in my look back years, so that way I don't increase my IRMAA, I don't have those extra monthly premiums for the life of my retirement. If it's just making sure that I enroll in Medicare as soon as I'm eligible and I'm supposed to, so I don't have those penalties tied to my overall monthly premium for the rest of my retirement life as well. These are small changes that we're able to make that allow us to be able to decrease our monthly expenses without us having to decrease the quality of care that we have. The reality is healthcare is one of the top 3 expenses that people have in retirement, but it is not considered a top 3 priority by most people when they're planning for their retirement. That's why I created a resource for you. It's called the Healthcare Cost Blueprint. I'll walk you through what Medicare really covers, how much you can expect to spend, real-life pricing examples, and 5 ways to cut costs without sacrificing your care. This isn't about cutting corners, it's about creating a retirement plan that gives you true peace of mind. So download your healthcare cost blueprint today, and if you want help building out your full retirement plan, I'd be honored to talk to you. I'll put a link in the show notes for you to be able to schedule some time on my calendar. But in the meantime, click the link, grab the guide, and let's get you ready for a worry-free retirement.